Okay. So earlier this week, I I frequently follow people who on Instagram in particular who talk about interstitial cystitis. And in one of the comment or as a comment on somebody else's post, I said, "Hey, I am able to help people with interstitial cystitis stop interstitial cystitis." And here's the thing, if you don't know what I'm talking about, imagine a UTI, right? Okay, so you've got cloudy pee, you have smelly pee, it hurts when you pee, and you have like a constant need to pee, and you're working around this day in and day out. That is interstitial cystitis. And what this leads to eventually, and like you have this every moment of every day, it's a problem to go to bed, like all of the things. It is miserable. Imagine like sitting through a meeting and having just this urinary urgency that is so bad, you don't know if you're going to make it another 10 minutes. Like, you literally don't know if you're going to be able to stand up in the middle of this meeting and walk to the bathroom, get your pants down before you pee all over yourself. That is interstitial cystitis. That is also chronic UTI. What happens is for many women, when we suffer from this chronic UTI, so we go into the walk-in clinic, we take a standard urine culture, it comes back positive, we walk out of there with antibiotics, right? We take those, it seems to make things better. We wind up, we get all of those same symptoms, the cloudy urine, the smelly pee, the burning while we pee, and the urinary urgency. Like, we get that back in spades. So we go back to the walk-in clinic, we take another standard urine culture, it comes back positive. We walk out of there with another round of antibiotics. And we do this over and over and over again until that standard urine culture comes back negative. But we have all of the same symptoms. So now what the hell do we do? What are our options? Well, for many of us, this is when we find something known as PCR testing. This PCR stands for polymerase chain reaction. What it does, you send in a sample of your pee to this lab, and they actually replicate the DNA in that pee to isolate it and determine, does this match any known bacteria species? And if so, which ones? And then you get on some more antibiotics in order to kill those strains of bacteria. The critical need to know information here is when you have advanced to PCR testing. Now there's a whole lot of theories about how there's biofilms and all of this kind of stuff inside the urine or inside the bladder, and it's kind of walled off the bacteria to protect them from the antibiotics. The key takeaway thing here, at least, this is one girl's theory, is that at that point it is a subclinical infection. In other words, like, it is not robust enough to see a positive standard urine culture. And yes, there's all of the things, well, some bacteria don't grow as fast in a standard urine culture. And it really is hard to see these kind of subclinical or microscopic infections, or is microscopic even the right word here? Anyway, long story short, so we go down that route and we continue to be on these antibiotics for a while. And then what happened for me is my practitioner, just to get me out of her hair, she prescribed a 28-day supply of Augmentin 875 mgs. And if you don't know about Augmentin, it's a powerful antibiotic. It's amoxicillin and clavulanate mixed together, 875 mgs, 28-day supply, like it's enough to kill a damn horse. And this is what she gave me. And I stood there holding that prescription slip in my hand going, if I take this, I am going to develop a case of C. diff because it is going to kill my entire gut microbiome. And I was already complaining to her about the fact that my liver hurt on the previous dose of Augmentin 875 that I only took for 7 days. Why am I getting so irritated over this? Because many women, this is the course, this is one of the paths they walk down. And ultimately, for many women, what eventually happens is their doctor gets tired of them as a patient, gets tired of them showing up over and over and over again. And so, to get them the hell out of their hair, they wind up saying, okay, I actually think you have interstitial cystitis. And Is there a diagnostic for IC, for interstitial cystitis? Yeah, there is. It involves a cytoscopy. So they stick a scope up your bladder, take a look around, see what the bladder walls look like. Oftentimes, in women who have UTI symptoms, with or without the positive standard urine culture, oftentimes that bladder wall looks irritated. It looks inflamed. It looks consistent with IC. And then, do you know what happens? Once you get that diagnosis of IC, it is a lifetime of needless surgeries, needless procedures in order to give you a microscopic amount of relief. And then there's people on Instagram who have found some relief through nutrition. But the problem is they do not know the whole story. And so here I am as a woman who I have been UTI symptom free now for a while because I resolved the underlying hormonal issue that was going on that was causing those UTI symptoms. Here I am offering complete resolution, complete relief from the symptoms, and I get yelled at for sharing a free article that I wrote for Hormones Matter, where I told my entire story, where I talked about the insulin resistance piece of UTI symptoms, which is one aspect of finding lasting relief from these UTI symptoms. At the end of the day, there are 3 hormones within your body that are worth considering when you struggle with UTI symptoms and when you've been diagnosed with interstitial cystitis. Those 3 hormones are comprehensively under one umbrella: thyroid hormones. The second one is insulin. The third one is cortisol. What makes you tick? You keep these 3 hormones in balance: thyroid hormones, again, one umbrella, insulin, and cortisol. And what this allows is your body to use the food that you eat in a way that supports healthy urination so that you are not suffering from UTI symptoms. Again, I write about this in Hormones Matter. There I share one aspect of this. We dial in specifically on the insulin piece. This is enough for many women to find complete resolution from their UTI symptoms. How do I know? Because it's where I started. It's where I found relief. And when I started writing about it, I had women reach out from across the country saying that because of what I shared, they found relief too. They implemented exactly what I proposed in that article, which is something I call BIDS, as in she bids good riddance to UTI symptoms. What does BID stand for? It stands for B vitamins, it stands for inositol, it stands for diet, and it stands for strength training. When you incorporate all of those, you hit reset on the way that your body uses insulin, and you are then able to start urinating in a way that is not constantly irritating your bladder wall. Again, this is one aspect of it. There are many key things to keep in mind, most notably the use of DEM. So this is diindolyl methane. This is a huge supplement. It's all the rage right now for lowering estrogen within the body. Little known fact, that estrogen, the reason why many women start experiencing UTI symptoms is because their estrogen levels fall, and this influences how the body uses insulin. And so when we are already in an estrogen deficient state, and why do I say that many women start experiencing UTI symptoms when estrogen falls? Is because many of us start experiencing UTI symptoms during that perimenopause menopause transition. This is a time when estrogen is naturally being reduced. Estrogen, once again, plays a key role in how sensitive your body's cells are to insulin. So, how able you are to turn the food that you eat, specifically the carbohydrates that you eat, into energy. This is also why women on a keto diet struggle a lot because they aren't getting enough carbs. This is why there's something known as keto crotch. Look it up if you don't believe me. All right, so back over to the problem with DIM. One of the problems with DIM is it lowers estrogen. Another problem with DIM is it is goitrogenic. What does this mean? It means that it hangs on to iodine. Your body absolutely needs iodine for health. Full stop. Your breast need it, your thyroid needs it, your ovaries need it, your cardiovascular system needs it. Most of us are highly iodine deficient, and then we are taking supplements like DIM, which have really high levels of these diindolyl methane compounds that are found in cruciferous vegetables that bind the iodine that make us even more iodine deficient. You absolutely need iodine for healthy thyroid hormone levels within your body, which plays a role in how your body uses insulin, which plays a role in how your body uses cortisol and makes cortisol and how stressed your adrenals are. So, for this reason, don't take the DIM. It will definitely exacerbate UTI symptoms and interstitial cystitis in those. Okay, so what are your key takeaways from this? Your key takeaways are hit the link below, read the articles on Hormones Matter, be sure you're getting your BIDs, your B vitamins, your inositol. Your diet needs to be such that it supports an insulin sensitive state, and strength train. Strength training, talking weight resistance training, pumping iron, okay? Pumping iron. That is the single best way to support insulin sensitivity in your body. And then we were talking leaving DIM at the door, right? We're tired of being gaslit, turn up the lights. All right, that's all I've got to say about that.